Hi everyone, Dr. Nemechek here. I want to talk about neck pain in particular and something all the time. Oh, I've had this chronic neck problem since I was in that car wreck or had that injury. I had a case here recently, 40 years ago, chronic neck problems. Just tight and x-rays are fine. Everybody looks at stuff and they can't find it out. And it's a very, very common thing, and it's actually from damage to the autonomic nervous system. Now, when you injure the brain and you don't bleed in the brain, which is your typical car accident, concussion, whatnot, you'll damage neurons in the brain. And the symptoms people complain of, typically are coming out of the autonomic nervous system. This is a part of the brain. It regulates your whole physiology, your emotions, your hormone, your metabolism, and your immune system. And as this graphic shows, it interacts and controls all the organs in the body, including your heart and your blood pressure. And so you get an injury, you damage some neurons. If you don't have inflammation, you fully recover. Okay? If you have chronic inflammation, like I talk about in all these other videos, you don't fully recover. Okay? And these injuries might not even be physical. You can have inflammatory injuries. Now that can happen from the stress of a scalpel cutting you, fracture of larger bones, vaccines, COVID will give you kind of an inflammatory concussion. And then it can also happen from emotional trauma. Death of a loved one, bullying, financial ruin, just whatever, just really threatening kind of emotional events will literally give you an injury in the brain. Again, all of these things, if you have no inflammation, you recover. But if you do have inflammation, something called cumulative brain injury occurs. So here the blue line is somebody who can normally recover. Now we have injuries here. Physical, emotional trauma. These are inflammatory. Surgery, fracture, COVID, vaccines. Okay. If you don't have inflammation, you get an injury and you completely recover. You go back to baseline over and over again. If you have inflammation, you have the injury, you feel like you're getting better, but you don't get better all the way. You leave damage behind. And this damage can build over time with successive injuries. Okay? And your symptoms can get worse and worse and worse. So again, chronic neck pain, oh, this is from that car wreck, or I got thrown from a horse, or blah, blah, blah. And actually, there's two kind of symptoms when you have problems here that occur. Well, two mechanical problems that give you a lot of symptoms, varying symptoms. Okay, get a brain injury. One big problem is, we'll start over here. One thing happens is your intestinal conveyor belt slows down. And so you can have what's called globus, which is tightening of the throat, dysphagia, a choke on food, and that's typically solids and liquids versus just solids. Reflux, heartburn, gastroparesis, that's when the stomach's not working right. Bloating, IBS, that's when the small intestine's not working right. Constipation, that's when the colon's not working right. And tenesmus is like spasm of the rectum. Okay? These can all occur after an unresolved brain injury. The other thing that happens is, I'll use this, it's easier to see. If the tip of this orange pen is your head, people have trouble pushing blood upwards and getting the proper pressure of blood in the neck and scalp muscles and the brain. And that leads to suboptimal oxygen flowing into the tissues. Now, in the scalp muscles, this is beginning to look like, in the research, all headaches, migraine, cluster, tension, everything but a sinus headache. Okay? If the same thing, you have lack of pressure in the neck, it's called Coathanger pain. All right? And the way you can differentiate Coathanger pain from like orthopedic pain, like actual problem with the bones and stuff, is orthopedic or low blood pressure pain tends to go away when you lay down because you get rid of gravity. You're able to get pressure there. So people, they may lay down with neck pain, but they won't wake up in the middle of the night with this problem. Okay? So there you can have headaches, neck pain. If the nerves in your upper cervical spine don't get enough, they won't function properly, and you get this like fluctuating neuropathy. It's not damaging. It's kind of like what might happen when you cross your legs funny and your foot goes to sleep. Here people have fluctuating like numbness or funny feeling in their hands, their face, their neck. Okay? The low blood pressure, if you have low blood pressure now in the brain, you can't focus, got concentration. This is attention deficit disorder, or this is brain fog in people. You can't balance right. The hunger goes up, anxiety, insomnia, frequent urination at nighttime. This is the list, folks. You get a head injury, it's one of these two things or a combination of these that you're being affected from. And all these should go away. So that chronic neck pain you've had for years, if it's better when you're laying down or better when you're active, like working in the garden or playing golf, it's from an injury that we can reverse with Nemechek protocol. All right. That's it for today. Hit subscribe if you haven't already. And otherwise, everybody have a good day. Thank you.